androgen abuse, risk adverse effects in men. Androgens testosterone. So they're not talking about anything. This is just stupid. So they're just talking about anabolic androgenic steroids. There's about a couple dozen of them that people use in varying doses, in varying concentrations, for varying durations. Like when they say cardiovascular toxicity, negative health consequences, cardiovascular toxicity, infertility, hypogonadism, hepatotoxicity, mental health disorders. What steroids? In what dosages? In what concentrations? For what duration? So there's a big difference between taking 200 milligrams of testosterone a week versus doing 1,000 milligrams of fucking trenbolone for months or years. So, like, what are they talking about? Secondly, cardiovascular toxicity. There's only a few compounds that directly negatively impact the heart, and it's typically 19 nors in high concentrations. Infertility, there's no evidence that steroids actually increase risk of infertility. Hypogonadism, all androgenic steroids are going to shut down your HPTA axis. So yeah, if you take any steroid for a long enough period of time, your natural test production's gonna go down. Typically goes back up after a few months when you stop taking them. And why would you stop taking them? Like, if you're gonna be on testosterone, why would you ever stop taking testosterone? So when they say hypogonadism, you're using exogenous androgens to not rely on your own androgen production. Like what the fuck are they talking about? Hepatotoxicity, that's going to be any like oral 5-alpha alkylated steroid. Okay, so just don't take those. Mental health disorders, again, that's typically just going to be 19 nors. Trenbolone in particular has negative mental health effects, but especially if you're taking nandrolone on its own without test, that can trigger mental health disorders. But again, like it's just nonsense. What steroids? What doses? You can look at the research on testosterone. Testosterone is a highly effective antidepressant. It's actually more effective than antidepressant medications. It's GABAergic, dopaminergic, and people who take higher doses of testosterone report better mental health and just overall feeling of wellness. So when they say this, again, what steroids, what doses, what concentrations, what duration of time, this is just a fucking completely ignorant moron who doesn't know what the fuck they're talking about. Here's some other fucking stupid horse shit. Erythrocytosis. Increased red blood cell count is not a bad thing. That is a normal adaptation to anything anabolic. It's also a normal adaptation to high altitude. So if erythrocytosis was such a big deal, then why isn't everybody in Stittsville, Colorado dead, since they're living at 5,000 feet elevation? And they all have erythrocytosis. Total cholesterol HDL ratio. Total cholesterol HDL ratio is just fucking nonsense. That's not a metric that's used anymore. When was this? 2024. So somebody who is not a cardiologist or knows shit about cardiology wrote this. Cardiac hypertrophy. The biggest risk factor for cardiac hypertrophy is going to be high blood pressure, which they mention here. So just because you take steroids, that doesn't mean you have high blood pressure. You can have high blood pressure for a number of fucking reasons. The only other modifiable risk factor for cardiac hypertrophy is going to be smoking. Other than that, it's all genetic. You can talk to massive IFBB pro bodybuilders who have been taking extremely high doses of anabolic steroids for over a decade. A lot of them don't have any cardiac hypertrophy. Dave Palumbo didn't. Ian Valair commented on one of my Instagram posts. He didn't. Dorian Yates, like 5 or 6 time Mr. Olympia. He was like 280 fucking pounds on stage. Walked around at 300 pounds body weight. No cardiac hypertrophy. Erectile dysfunction and fertility. Again, what steroids, what doses, what concentrations, what period of time. And there's no evidence whatsoever that steroids induce permanent infertility. That's just nonsense. Bloodborne viruses. They can affect your immune system. I don't know why they say bloodborne viruses in particular. But in high doses, they can reduce your immune function. But lots of things can reduce your immune function. High-intensity exercise reduces immune function. That's why athletes really have to be careful when traveling, because they're more prone to getting some kind of infection. Hepatotoxicity, again, that's primarily just going to be 5-alpha-alkylated steroids, so oral compounds. Just don't take them. Tendon rupture, muscle abscess. Getting strong increases your risk of tendon rupture because you're just lifting more weight. So are they going to recommend not being strong? Don't get strong in the gym? Why would you ever try to bench 400 pounds? Like, it's just stupid. And again, there's certain steroids that put you at higher risk because of how they cause tendon remodeling. Winstrol is one of the worst. Winstrol changes the way your body synthesizes collagen, and it prioritizes the production of a certain type of collagen, and it also affects cortisol. And what ends up happening is it does weaken your tendons and makes them more brittle. So don't take compounds like Winstrol. Stick to compounds like testosterone. Make sure your estrogen levels are adequate, and you can also take advantage of compounds like boldenone, nandrolone, and or human growth hormone, which promote collagen synthesis and make your tendons stronger. So again, this is a fucking ignorant moron who has never taken steroids, can guarantee you every single one of these fucking people. By the way, these all sound like female names. Bonnie Grant, Elizabeth Hines, Rihanna, Sucks. Yeah, listen to somebody whose name is Sucks. Channa and Jason. These are all women. These are just orals. They're not technically a specific class of drug or class of steroid. Then there's 5-alpha reduced steroids. Anavar is 5-alpha reduced. So it's basically a DHT derivative. They don't mention that class, and they don't mention the testosterone derivative class. And so they only mention testosterone in 19 Nors, really. They didn't even really put these in the right class of drugs. So boldenone is an extraordinarily common steroid, especially now, because Masteron and Primo aren't on the market right now. They don't mention that. They didn't mention Masteron or drostanolone or Primobolan, which I think the generic name is methanolone. They don't know what they're talking about, clearly. Adverse effects. Oh my god. The abuse of androgens is associated with 3-fold increase in mortality. Where is this? 47. So this is a retrospective study, which means it's very low on the hierarchy of evidence because of the risk of bias. Subjects were matched with 5,450 male controls. 644 men who were sanctioned because they refused to submit to a doping test. Mortality was 3 times higher amongst users of AAS amongst non-user controls. Hazard ratio 3.0. Median annual number of hospital contacts was 0.81 in the cohorts. AAS users 0.36. Oh wait, 0.36 in the control group. Okay. Acne, gynecomastia, erectile dysfunction affect more than 10% of androgenic anabolic steroid users. Prevalence of these disorders is significantly higher. Results could be replicated in a similar cohort. So the fundamental problem is this is retrospective. I don't know how they went about collecting subject data in the steroid user cohort. Again, what steroids, what duration, how long, what other drugs were they taking? That doesn't, it just doesn't say much. Cessation of androgen abuse should be encouraged in all men. They're not actually defining what constitutes abuse. In reality, however, this can be difficult. Single suppressed serum LH levels being shown to correctly identify androgen abuse in 89%. What do they mean by abuse? If you're on testosterone replacement therapy for hypogonadism, you're going to have suppressed luteinizing hormone. So they're not even defining what constitutes abuse. They mention hypogonadism and sexual dysfunction. Okay, don't stop taking testosterone. Neuropsychiatric, body dysmorphia, they would have already had that problem. Mood disorders, aggression. There's literally no evidence that it causes aggression. It's just self-reported anecdote. And again, what steroids, what doses. Hypertension, they can cause hypertension, but again, you don't have to take a dose that causes hypertension, and you can just take blood pressure lowering meds. Reversible impaired ventricular function. So this is just hypertrophic cardiomyopathy or left ventricular hypertrophy. Again, that's not a thing that's necessarily caused by steroids. Dyslipidemia, lower high density lipoprotein, that doesn't matter. Increased low density. Typically, when men do testosterone replacement therapy, their LDL actually goes down. Steroids can increase your LDL. But again, you can just stick to a clean diet, low in saturated fat, make sure you do daily cardio, and you can take cholesterol-lowering medication. Erythrocytosis, increased hemoglobin, hematocrit, that's not a problem, that's a good thing. Hepatotoxicity, and they mention it's only associated with oral steroids. So they mentioned gynecomastia. The number one thing that I've seen cause gynecomastia is nandrolone. So especially if you're taking nandrolone with testosterone, pretty much everybody gets gynecomastia from that. So just don't take nandrolone. It's very easy to prevent gynecomastia if you're just on testosterone. Neuropsychiatric issues. They mentioned a double-blind, placebo-controlled trial. They used methyl testosterone. So this is an oral form of testosterone that absolutely destroys your liver. Do you think that might have had something to do with their irritability? Like again, there's a large scale meta-analysis. There's a meta-analysis of large population or prospective cohorts and randomized trials on this. Men who are on testosterone feel better. They have better mental health, and as the dose increases, they report better mental health. And then they blanketly say 23% of men abusing androgens had a major mood disorder. What steroids were they on? And they may have had a mood disorder to begin with, which is what encouraged them to take fucking steroids. Hypertension, we already went over this. The dyslipidemia and bullshit, we already went over this. Erythrocytosis is like the biggest meme thing to mention. Testosterone stimulates erythropoiesis, supraphysiological levels, blah, 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 result in significantly raised hemoglobin levels. Even in men receiving testosterone, replacement therapy for hypogonadism, erythrocytosis can occur. Dose dependent. The abuse of androgens has been linked to coagulant state and thrombosis. That's not true. Elevated hematocrit does not increase your likelihood of developing a blood clot. So even with a hematocrit of 70, which is way off the charts high, it doesn't necessarily increase your blood clotting risk. Blood clotting's multifactorial. Again, if erythrocytosis caused blood clots, thrombosis, strokes, everybody in Stittsville, Colorado would be dead. Everyone living in the Himalayas would be dead. They're regularly walking around with hematocrits of over 60, some of them in the 70s. Why aren't they dead? So this bullshit, this stupid bullshit that they're mentioning, this is based off of cancer studies where cancer patients who have erythrocytosis, they're at increased risk of blood clots. But that's probably not from the erythrocytosis. That's just from some other factor that cancer's affecting that's affecting blood clotting risk. But like this is being debunked. They've looked at men on testosterone replacement therapy. They have elevated hematocrit. They're not at increased risk of blood clots. Hepatotoxicity, so just don't take orals. Acne, again, like this is just silly. It's kind of like saying if you drink alcohol once, you're going to kill your family. Like there's some angry drunks. There's some like people who drink moderately and they're calm when they drink. Like what are we talking about here? What steroids, what doses? Like they're acting like if you just take a little bit of steroids, you're just going to break out in acne. Bloodborne viruses and infections. So I mentioned this already. They can affect immune function, but this is weird. It's recognized that people who inject drugs are at risk of bloodborne viruses such as HIV, hepatitis C. Well, that's for intravenous drugs. HIV prevalence of 1.5% in men. Injecting IPEDs? What is an IPED? This is really weird. So, the only thing I can figure for why you see a higher prevalence of HIV in men injecting steroids, I'm assuming that's what it stands for, is because there's a higher prevalence of gay men taking steroids. And it just ends up working out statistically. You see the small increase. Assuming this is even accurate. So, in addition to BBVs, I don't know what the fuck some of this shit is. The use of injectable androgens increases the risk of damage at the site of the injection and bacterial fungal infections. This is so use safe injection techniques. It's just strange. Like, okay, don't get vaccinated because you could get an infection from the needle. It's possible. It's like it's just weird. So they don't really go over any good evidence, and they completely misrepresent the research. It's kind of weird they mentioned erythrocytosis because there's just recently a massive review on the use of testosterone and risk of blood clotting from erythrocytosis, and they don't mention that. So, look, these are just a bunch of bitch beta male women who are like feminists who are trying to demonize masculinity. Like, notice how all the authors there were female? It's just nonsense.